Hey there, and welcome to This Explainer. I am absolutely thrilled you're joining us today. Look, if you or maybe someone you really care about just got out of shoulder surgery, you are in exactly the right place. I want you to kind of shift your mindset for a second here. Think of that freshly operated shoulder, well, not just as an injured joint, but as a beautiful, highly complex, and newly repaired machine. The surgeon, basically your master mechanic, they've done their job in the OR. But right now, to get back to peak performance, that machine needs proper, precise recalibration. It needs a roadmap based on top medical guidelines to make sure it heals up perfectly. And honestly, that's exactly what we're going to build together today.
So, you survived the surgery. Now what? I mean, it's completely natural to look down at your arm, all wrapped up in that massive, bulky sling, maybe still feeling kind of groggy from the anesthesia, and just get hit with a sudden wave of anxiety. You're probably sitting there wondering, am I going to mess this up, or what am I actually supposed to do today? Let me just validate that right now. It is totally 100% normal to feel that way, but go ahead and take a deep breath. We've got you covered. Today, we're giving you a crystal clear, highly actionable guide. We've taken the absolute best, peer-reviewed recovery data straight from the American Academy of Orthopedic Surgeons, Medline Plus, and the Mayo Clinic, and distilled it all down for you. We are taking the guesswork entirely out of the equation.
Okay, let's dive into this. Here's our roadmap for today. Number 1, first days at home. 2, managing your daily care. 3, gentle early movements. 4, building strength safely. And finally, number 5, warning signs to watch. Let's get right into it.
Section 1. First days at home. The transition.
Right now, as you make that move from the hospital bed to your own living room sofa, your main job is actually incredibly simple. Just let the machine rest. These are your direct discharge instructions, simplified right from Medline Plus into 3 critical steps. Step 1, rest. Your body just went through a controlled trauma, right? It needs a ton of energy to kickstart that cellular repair process. Step 2 is ice. Now, ice isn't just about numbing the pain. It's literally a powerful physiological tool. When you apply cold therapy, it constricts those local blood vessels. That actively shuts down the inflammatory cascade and stops the swelling that stretches your tissues and causes that throbbing ache. And step 3 is elevate. Keep that shoulder propped up, especially when you're resting or sleeping. This uses gravity to naturally drain excess fluid away from the surgical site. These 3 steps, they are absolutely non-negotiable. They are the foundation that protects your fresh surgical repair when it is at its absolute most vulnerable.
Moving on to Section 2. Managing your daily care. Life with a healing shoulder.
Now this is where we adapt to the daily maintenance phase. Living with the sling can feel super awkward, I know, but I promise you, it's a temporary and totally crucial part of healing. Now what's really interesting about this slide is how these seemingly small, mundane habits are exactly the things that prevent accidental damage to your surgeon's hard work. First off, keep the sling on exactly as directed. It's literally a physical barrier and a structural support for those healing tendons. When it comes to showering, follow your specific rules. Usually that means keeping incisions bone dry and maybe just letting the arm hang safely by your side without actively lifting it. And speaking of lifting, strictly observe those lifting restrictions. Even picking up a heavy cup of coffee engages those recovering muscles way more than you'd think. Lastly, support that arm while you sleep. Use strategically placed pillows so your shoulder doesn't roll backward and stretch out the repair. Think of these do's and don'ts as the safety guardrails keeping you on the road to recovery.
All right, Section 3. Gentle early movements. Reactivating the shoulder.
We're going to build some energy here because we're officially entering the rehabilitation phase. We're shifting our mindset from pure rest to gentle recalibration. At this stage, movement equals progress. According to the American Academy of Orthopedic Surgeons, your absolute best friend in early recovery is going to be the pendulum stretch. What is it? Well, it's this incredibly gentle exercise where you lean over, usually resting your good arm on a table for support, and just let the surgical arm hang and swing freely in small circles. Why is this so brilliant? Because gravity is doing the work, not your muscles. Gravity gently distracts the joint, which promotes early mobility and keeps scar tissue from locking up the shoulder. And it does all of this without putting any strain on those newly repaired healing muscles. It's just perfect, safe, passive motion.
So the crucial point here, and the magic number to remember, is 3. You'll generally aim to do these gentle pendulum exercises 3 times a day, or, whatever exact number your physical therapist prescribes. But I really want to hammer this point home. Consistency, rather than intensity, is the master key here. Doing a gentle, gravity-assisted stretch 3 times a day gives you vastly superior results compared to doing an aggressive, painful stretch once a week. Your body craves that steady, predictable routine.
And that routine leads us perfectly into Section 4, building strength safely, progressing your rehab.
Hitting this stage is a massive milestone in your timeline. You are building real forward momentum now, and that's definitely something to celebrate. And this brilliantly illustrates the crucial difference in your rehab journey moving forward. Phase 1 is passive movement. That's where your physical therapist, or even your own uninjured arm, does all the heavy lifting to move the surgical limb. The muscles of the repaired shoulder, they stay completely relaxed and asleep. But eventually, you transition to Phase 2, active movement. This is when those repaired shoulder muscles finally wake up and you start using your own strength to move the arm against gravity. But here is the golden rule. Never, ever skip ahead. Actually, let me repeat that. Do not rush this. You cannot jump from passive to active before those tissues have fully anchored to the bone. Respect the timeline between these two phases, and your strength will return safely and steadily.
Finally, Section 5, warning signs to watch, knowing the red flags. I want to shift into a very clear, serious tone for a second here. Look, every complex machine has a check engine light, and your body is absolutely no different. Drawing straight from Mayo Clinic data, we've got normal healing on one side and medical red flags on the other. Normal healing means, yeah, you're going to experience mild soreness, you're going to have joint stiffness, especially in the mornings, but overall you'll see a gradual daily improvement. That's just your engine humming along, doing its job. On the flip side, we have medical red flags. If you develop a high fever, or maybe sudden, severe swelling that wasn't there yesterday, or spreading redness that feels hot around the incision site, those are your check engine lights. Knowing the difference between expected, everyday discomfort and actual medical emergencies is super empowering. It means you know exactly when you need to call your doctor. And, just as importantly, it saves you from unnecessary panic when you're just feeling the normal, everyday aches of the healing process.
Healing isn't a race, it's a routine. Recovery from shoulder surgery isn't about who can ditch the sling the fastest. It's about waking up every single day, managing your daily care, doing those gentle movements consistently, and actually listening to what your body is telling you. You've got the roadmap now. You have the guidelines right from the top experts in the world. The recalibration of your machine is entirely in your hands. So, are you ready to start your routine today? Thank you so much for joining me on this explainer. Keep resting, keep healing, and we'll see you next time.